Okay, this clip will be short, I promise. So finishing up with the eating disorders, the complications of binge eating disorder, which we talked about in the last clip, are the same as are for obesity, which we talked about in the obesity section. So as far as the treatment of eating disorders, the goals are weight restoration, if appropriate. If a person is malnourished from anorexia and emaciated, weight gain is needed. If a person is overweight or, mildly obese, self-acceptance and focus on behaviors and not actual weight is important. In fact, even if a person with an eating disorder is obese, you de-emphasize weight and focus on self-care and healthy behaviors. I haven't talked a lot about body image. That's a lot of people have body image disturbance in this culture. And the eating disorder experts that I've trained with, as far as dealing with body image, what they're focusing on now is redefining yourself. A lot of us define ourselves in terms of appearance. And, there's the people I've trained with, which are some of the, best in the world. Anita Johnston, Carolyn Costin, Francie White. They focus a lot on spirituality and, defining yourself not by your appearance and, thinking about who you really are as a person, that your appearance is just an outer wrapping that contains the soul. And so focusing on defining who you are outside of your appearance, which I can tell you changes over time. It's not really who you are. So that's what they do when they're working with people with body image disturbances, is they focus on a redefinition of the self. A normalization of eating and attitudes towards food, treatment of any comorbid psychiatric conditions like depression or anxiety, things like that. Treating and preventing medical complications, like the fluid electrolyte imbalances, things like that. And then prevention of relapse. So medications are used sometimes. There are some medications that can help, some psychotropic medications, psychotherapy, behavioral nutritional therapies are important as well. So the options are inpatient, intensive outpatient, and outpatient. The thing that professionals with eating disorders struggle with is insurance reimbursement. Even though anorexia is the psychiatric disorder with the highest mortality rate, reimbursement for inpatient treatment of eating disorders isn't great. So that's always a struggle. Intensive outpatient is where you spend, you can go to your work, and then you spend a lot of time in the outpatient center and you sleep at home. And then outpatient would be something like seeing a dietitian and a therapist, for hour appointments once a week or something like that. So again, like I said before, the earlier in the course of the condition the treatment occurs, the better the prognosis. You don't want to let those behaviors become entrenched. Because, this is a nutrition class, I'll focus on the dietary recommendations. Oh, by the way, one of the women that I train with, she posted an article that, people think that once you resolve the depression or anxiety or body image disturbance that the behaviors, will then change. There isn't time to wait for all of the resolution of the mental issues before the behaviors change, because, people suffer with periods of depression for a lifetime. So waiting for depression to resolve to improve the eating behaviors isn't isn't really realistic. So she says that, some therapists I've talked to who don't really know a lot about eating disorders think that once, the person resolves the underlying problems, that their eating behaviors will improve. That's not necessarily the case. So there's some behavioral type things that you can do to help, improve the, eating and health behaviors, before all of the other issues are resolved. So anyway, as far as the diet is concerned, you want to avoid the refeeding syndrome. We talked about that in the protein section. If a person's severely malnourished, from anorexia, and that woman that I talked about a couple of times in these clips, who's gone several times into inpatient, even the Dr. Phil Show sent her one time. She has experienced the refeeding syndrome with tube feedings when she's been hospitalized. Regular meals and snacks, basically, as far as the nutrition therapy, you start with 3 meals a day and maybe 1 or 2 snacks, and it's pretty regimented because people with eating disorders have learned to ignore their hunger and satiety cues. So you want to kind of normalize the eating behaviors in a structured way, so that they can start thinking about hunger and satiety and develop some, kind of some new habits. And then eventually you start working on intuitive eating and a less regimented dietary approach. Behavior modification, like avoiding triggers for binges and things like that, substitute behaviors for coping mechanisms, like I said, listening to hunger and satiety cues, and controlling the environment, especially if a person is prone to binging, so that, they don't have those cues to think about food. So those are some of the guidelines. Usually they start with it starts with kind of a regimented eating protocol, then transitions to more of an intuitive eating. You don't focus on weight. You focus more on behaviors and self-care and things like that. This is something I found online from one of the professional organizations, how to help someone with an eating disorder. So you can take a look at that. Remember, the slides are on the Blackboard. It can be frustrating if you know someone with an eating disorder. You wonder why they can't just start eating if they have anorexia, why they can't just stop purging. It's more complex than that. So you need to know that, you can't control a person or offer simple solutions. And, remember that saying, you can't shame someone into changing their behaviors. There is this eating attitudes test that is an indicator or a screening tool for eating disorders. It's a questionnaire that can kind of gauge a person's risk for eating disorders, and I have the website there that has access to this online test. And this is a website that lists a lot of different professional organizations for that are related to eating disorders. That's really cool. So this ends the section on eating disorders, and the next and last section is on nutrition and exercise or sports nutrition.